Hey everyone, it's Dr. Sanam Dillon, specialist doctor and founder of Rockmelon, evidence-based skincare for melanin-rich skin. This channel is here to cut through misinformation, noise, and help you protect and nurture your beautiful brown skin with clinically backed science and doctor-approved tips and tricks. And most importantly, to remind us that our melanin-rich skin is powerful, it's beautiful, and not something to bleach or whiten. What's the quickest way to get the most out of a home DIY treatment that doesn't involve microneedling and only takes 10 to 15 minutes every single week so that your skincare works way longer and less harder for your skin? Yes, that's right. It is dermaplaning. This is what I started out with. And this is what we have developed at Rockmelon. I'll talk to you about it in a bit. First of all, many of you might already do it. You might have heard about it, but essentially dermaplaning is a method of resurfacing the top layer of your skin. It is essentially a mechanical or a physical way to exfoliate your skin. There's two main methods of exfoliation. One is chemical, with chemical peels, your daily cleansers that have things like salicylic acid in it, AHAs, BHAs, PHAs, or your mechanical exfoliation techniques, which include things like hydrofacials, microdermabrasions or dermabrasions, and dermaplaning, which is what we're talking about today. So what is dermaplaning and why is it the most underrated skincare DIY hack that you could be doing at home? And why I never need to see a facialist to do it? So dermaplaning is essentially exfoliation or a skin resurfacing technique. So when you look at your layers of your skin right here, you've got your epidermis, your dermis, and your subcutaneous tissue. The epidermis, or the top layer of your skin, has 6 layers within it. And the topmost layer helps protect it from the environment and also provides a barrier and helps you retain moisture underneath your skin. However, this top layer of your skin, called the stratum corneum, often has a lot of dead cells or dead keratinocytes called corneocytes. And these corneocytes have benefits, but when our skin doesn't turn over as quickly as we age because of certain conditions like eczema, we often find we need to actually help the process of moving your corneocytes along so that we can help regenerate the skin and turn over new skin cells. What dermaplaning does is uses a scalpel to remove the upper portion of the top layer of your epidermis, or the stratum corneum. This is where your keratinocytes lives, as well as your corneocytes, which are dead keratinocytes. Keratinocytes is just one component of your skin cells. And the aim of the game is to reduce the burden of dead cells, aka corneocytes, by exfoliating them away or removing them away with a scalpel. Usually your dead skin cells or your corneocytes shed on their own, but we're just hurrying the process along by using methods of exfoliation, whether it be chemical or mechanical. Overdoing it can cause problems, but not removing them has actually been shown to be a problem in itself because it can block the skin's ability to retain moisture, and in conditions like eczema, where you're deficient in moisture, this can be a problem. It sounds counterintuitive, but those cells become dormant, they lie there, and they are unable to allow the skin to actually work effectively to retain moisture. As a sufferer of eczema, perioral dermatitis, and I get post-inflammatory hyperpigmentation or dark spots at the drop of a hat with extremely sensitive skin, these issues are not unique to me. And these are common biological issues that melanin-rich skin face, and we call them melanin's problem 5. We needed to think of things to exfoliate our skin without triggering melanocytes, which are the melanin producing cells or pigment producing cells in our skin, which can lead to hyperpigmentation. So why is exfoliation important, and what are the benefits of dermaplaning your skin? There are 6 main benefits to using a dermaplaner, and the last 2 are my absolute favorite when it comes to results. Number 1, it improves your skin texture. So it smooths out an uneven skin tone, the rough textures, the bumps, the little whiteheads that just need to be combed away. It can help just remove that and allow you to have glass-like skin. which is still safe for melanin-rich skin. Number 2, it reduces the appearance of fine lines and wrinkles, but this only happens over time. You're not going to see it after one exfoliation session. The way it helps reduce the appearance of fine lines and wrinkles is the exfoliation can actually help stimulate collagen production. It wakes up your cytokines and tells your fibroblasts, hey, wake up, let's make more collagen. This can make your skin appear more youthful. As you know, collagen is the building block for your skin to appear youthful, and that is how it does it. The second thing is, by allowing the dead skin cells to move along, it also allows penetration of your active ingredients. And when you allow penetration of serums into your skin, this works in your viable skin cells to help it produce more collagen or wake up your collagen stimulating cells called your fibroblasts. So by dermaplaning and then following it with a gentle vitamin C, it has a double effect for reducing the appearance of fine lines and wrinkles. Number 3, it can provide a clearer and brighter complexion. So it helps unclog your pores, removes impurities, and it can make it appear clearer and brighter. And this has to do with how light reflects off your skin. It can reduce the appearance of dark spots by evening out your skin tone and by allowing the top layer of your skin to be more even. The light that reflects on it appears more even in itself. There's less of an uneven textures and bumps, less shadows, and that's how you get the overall appearance that your skin is more clearer, it's brighter, and has less dark spots. Number 5, and one of my most favorite, it helps with the absorption of your skincare active ingredients. It's really hard when you have put on skincare actives onto dormant skin cells that are dying and dead. They haven't turned over, and you're just like packing on product on top of that. You need to have a fresh canvas to start with. And the beauty about dermaplaning is you're allowed to remove those dead skin cells off the top layer of your epidermis and then allow the actives to actually penetrate to where they're going to work and where they are needed, which is in the lower layers of your epidermis and sometimes your dermis, which is the deeper layer of your skin. There's just no point putting a layer of skincare on top of skin that is not going to actually utilize it to the best of its ability. In terms of benefit number 5, what I love to do is I love to use my dermaplaner at least once a week. Start fresh, particularly on a Sunday when I'm doing my self-care days, and it's okay if my skin's slightly red from using it, and then going in gently with a small dose of my Dewy Glow serum, because this has no retinol in it, which isn't going to burn, but it's got niacinamide, vitamin C, and bakuchiol, which pairs really nicely with a dermaplaner, even with my sensitive skin. Some weeks I skip the Dewy Glow serum and use a moisturizer, particularly if I'm more sensitive or if I've got more hormonal acne. But weeks that I feel like my skin can take it, using an active ingredient serum, allowing it to penetrate right after I've used the dermaplaner, has really, really good results personally. And number 6, I think this is my most important benefit of using a dermaplaner. It is because of makeup application. It makes my makeup and foundation glide on so smoothly. I don't have makeup that cakes around bumps and milia or whiteheads. Just, it's like a smooth, even distribution of my foundation. It really does give glass skin when I've done a dermaplaning session and the next day gone in and applied makeup. I don't recommend doing this, but sometimes if I've had an area of hyperkeratinization or an area where I've got lots and lots of flaky skin, I will do a very gentle dermaplane, cleanse really well, moisturize, and then put a foundation on if I've got an event to go to or something where I really want my skin to look flawless. That said, it's really, really important that we talk about some risks of over exfoliation and the risks of irritation, dryness, and redness if it's done too often or if you're using really harsh products afterwards. And hence, it's a really good idea to actually start with a lower frequency. When I started dermaplaning, I only did it once a month with very gentle, few passes in certain areas that were less sensitive. But we will go into all of those juicy details in a bit with my do's and don'ts section, which you can skip ahead to later. Now, for all my nerdy science girlies, I do want to go into the evidence behind dermaplaning and why it's my preferred method of exfoliation. Because you must be thinking, come on, I'm holding a blade onto my face. Surely that isn't safe and should be done in a professional's hand. It's all about doing it the right way without cutting yourself. Dermaplaning is actually considered safer as a form of exfoliation by dermatologists and in the medical literature than things like a chemical peel or microdermabrasions, and often in patients with eczema or sensitive skin. So dermaplaning is excellent because there's lots of control over how much exfoliation you're doing in a certain area. There's lots of feedback from the patient about, is it sore? Is it not? And personally, when you do it yourself, when you try it out, you'll be able to tell which areas are hurting, itching, burning, and which aren't. The main thing about dermaplaning is listen to your skin. When you try doing it at the start, you need to understand the feedback and not just keep hacking away with the scalpel. You just need to be patient and start low and go slow. Most men essentially dermaplane every day when they shave their face, and this is thought to be helpful in collagen stimulation and why we sometimes think that males age less or have less fine lines and wrinkles around that region because of shaving. But I think there are multiple factors in play: testosterone, skin elasticity, menopause. So that's a whole different topic. But we do know in small scale studies that dermaplaning has been shown to be effective, particularly for the benefits that I've talked about. So what is the evidence? Does dermaplaning reduce pigmentation or remove pigmentation? It can improve pigmentation by improving the way the light hits the skin and optical qualities of the skin and how we perceive the skin. So it has better light transmission when you're able to dermaplane. There are little tiny melanin granules in the top layer of your skin in the stratum corneum, but the bulk of your pigmentation issues are much deeper than that. And when you have things like deep dermal pigmentation or pigmentation that's been there for a very long time, dermaplaning is not going to get rid of that. So if anyone's telling you that, that is completely unfounded and unresearched, but it does help overall with the bounce and reflection of light. Personally, when I dermaplane, particularly when it removes the peach fuzz and the villus hairs on my face, that reduces the gray and ashy appearance of my skin and lets light reflect, which gives it that glass skin appearance for melanin-rich skin. The second thing is, even though a dermaplaner can't penetrate deep into your dermis or lower parts of your epidermis where pigmentation is a problem, where your melanin will sit, it does allow your active ingredients to penetrate deeper. So over time, dermaplaning and your active ingredients, the cumulative effect of that can help reduce the appearance of pigmentation. A small scale study by Frangpong et al. In 2022 showed that in vitro studies of dermaplane skin and non-dermaplane skin, dermaplane skin had much better absorption of the stain that they used as a topical ingredient called methylene blue. It reached the layers of the skin that were in the lower dermis and even sometimes the dermis compared to underdermaplane skin, where there was nothing done to that section of skin. So we know for a fact that it does penetrate deeper, and that penetration allows the active ingredients to actually work their magic on your biological cells and change the biology of your cells, and in turn help with issues like pigmentation. If you've been doing dermaplaning and you're doing it correctly and you are using the right skincare active ingredients like tyrosinase inhibitors, vitamin C, niacinamide, but you're still not getting a benefit from your dermaplaning, go check out our videos on pigmentation issues. And really at that stage, I would be consulting a dermatologist or a skin of color friendly general physician who knows what they're doing with skin to consider things like a pico laser or other forms of treatment for pigmentation issues, some of which are chronic and need to be balanced over time and may never go away, but can be faded or reduced. Number two, what does the evidence say about eczema-prone skin and sensitive skin with dermaplaning? A case study done on a patient with really severe eczema, particularly around the ear, and over many months they dermaplaned the ear with a scalpel. And what it showed was that by removing the dead skin cells, you were able to improve the barrier function, which sounded really bizarre to me initially, but it helped improve the barrier function of the skin because the active keratinocytes were able to retain moisture a lot better than dead skin cells. So in patients with eczema-prone skin, dermatitis-prone skin, we actually recommend gentle, slow dermaplaning as a way to improve the overall texture of the skin, but also long-term help with the chronic nature of the condition, which is a moisture deficiency, which is an inability to hold and support the skin's barrier function. So dermaplaning can be really excellent for that. It also obviously helps with the penetration of active ingredients, which again helps in changing the biology of the skin and affecting the pathophysiology or the disease process of eczema or dermatitis underneath all of those dead skin cells. Medically and in dermatology, we love dermaplaning for conditions like PCOS, polycystic ovarian syndrome, and in states like pregnancy or those with ultra-sensitive skin. This is because we know that chemical peels, microdermabrasion, can be much too harsh for your skin, and in pregnancy and in PCOS, when there is a greater degree of hormone burden that can cause you to have lots more hair, it is an effective way not only to manage your skincare but also to manage the hair growth. Coming to hair growth, we do need to talk about a few things, but go check out the section where I talk about how to do it effectively. Make sure that you're the right candidate for dermaplaning. So let's get on to that actually. When would you avoid dermaplaning? This is so important, particularly for melanin-rich skin, because you do not want to trigger pigmentation and complications. In people who have things like PCOS, polycystic ovarian syndrome, and what we call hirsutism, which is hormone-driven hair growth around the beard area, the mustache, the forehead, if you've got coarse, tightly packed, thick hairs that are curly, you do not want to dermaplane, particularly on a regular basis and particularly if you're prone to ingrown hairs. This is because it can contribute to a condition called pseudofolliculitis or folliculitis barbae, and this is much more prominent in people with skin of color. Here's a photo of what this condition looks like. It's essentially a complete breakout of the skin after a session of dermaplaning, a session of shaving in males with people with tightly coarse or curled hair, because it can cause extra inflammation, particularly during the time of hair regrowth, where the hair curls back in on itself, causes ingrown hairs, and causes complete overreaction to the ingrown hair, which is known as pseudofolliculitis barbae. This is much more common in melanated people with a darker skin tone and in African American or African males. In women with PCOS, if you have very fine, light hairs, it's still fine to dermaplane. It's only if you've got those really curly, tight, coarse hairs. You can opt for treatments like an ND-YAG laser for laser hair removal before you consider doing dermaplaning on a regular basis. Other times you really want to avoid dermaplaning is if you've got a cold sore or an active outbreak of herpes simplex virus. If you've got really raw and open skin, you don't want to dermaplane because there's no point. It's already open. It's already raw. You've already lost that top barrier layer of your skin. If you've got lots and lots of scaly, dry patches, but not lots of redness, dermaplaning is perfect in that scenario. So that's where you want to opt for it. So in certain circumstances, you want to get on top of your condition with topical steroids. On the face can be risky, so you need to do this under guidance of your general practitioner. but you want to get on top of the disease process and then consider dermaplaning. You want to avoid dermaplaning over areas that might bleed. So things that are pokey outy, and if you go over it with a blade, it might cut open and bleed. So these are areas with freckles that are pedunculated or come out of the skin, skin tags, and moles. You also want to avoid dermaplaning if you have been sunburnt or you have an area of burn over your face and your skin. Like me, used a hair straightener or a curler, burnt yourself, and you see stuff flaking off and you feel like, I'll just go dermaplane over that. You do want to actually avoid. You want your natural healing process to come through, and then you want to go in with your tyrosinase inhibitors to prevent hyperpigmentation. But you don't want to dermaplane because you've already compromised the top layer of your skin by burning it off, so there's no reason to actually dermaplane. Once you kind of understand the concept of why you're dermaplaning, it really helps you understand when you shouldn't or when you can or can't dermaplane. You also want to avoid dermaplaning if you've got an active breakout and severe acne. Cystic acne is not going to respond to dermaplaning over the top of the lesion. It's just much deeper in the skin because, again, remember, if we think about the science behind it, you can think about whether it's going to be effective or not. So things that are much deeper in the skin, you don't need to dermaplane, and you don't want to also ruin the area of cystic acne that's already trying to heal that you're putting actives on top of, because it's just not going to actually benefit in that circumstance. If you don't need to do it over that area and you've got a really bad acne breakout, avoid it, because opening up pus and opening up acne spots is also not recommended. And obviously, if you've got a shingles rash, particularly over your eye or your facial area, you don't want to dermaplane. One, you're going to potentially contaminate your tools and you don't necessarily want to sterilize them. And two, it's just going to spread that disease or condition elsewhere and potentially to other people as well. Okay, so now that we know when we shouldn't dermaplane, you've ticked off that you're not part of that list. Let's get into how to effectively dermaplane. How should you be doing it at home? Do you need to go see a clinician, facialist, a beautician, or should you just use other methods of exfoliation instead? So I would say that if you've got the right tools at home to dermaplane, so I would recommend using tools that you can use or change regularly. So often these plastic dermaplaners are great, but they only come with 2 or 3 in one packet, and there's a tendency to reuse these multiple times. That's why I needed something that was, 1, environmentally friendly, and 2, that I could just replace the blades and still get a really good, reliable scalpel or blade that was easy to replace. So that's why we created the Rockmelon Dermaplaner. This is called the Glow Blade Dermaplaner because it pairs really well with our Dewy Glow Serum, and that's what a dermaplaner does. It gives you a glow. So it's got a replaceable scalpel, so you can take it off, and it comes with 5 blades, so 6 in total, that are neatly packaged in here. They are all Swedish steel, which means that you can wash them underwater and they're not going to rust, unlike the ones that you get from really cheap online eyebrow razors. So they don't rust. You can replace them usually after 3 to 4 uses. I replace them, or every single month. So this should last you at least 6 months. And it is a really easy to use tool because it's quite heavy, which means that there's lots of ability to actually get a really good grip on it. It's not lightweight and like slides. I've cut myself a lot of the times because it's just lightweight and just moves really easily. And there's also a really nice pen grip location. Just like holding a pen, there's a divot here where you can hold it and have really good accuracy when you're using this dermaplaner. You often don't have that with traditional dermaplaning tools. So that's why I had to create this, and also environmentally friendly, and gosh, it looks so cute with my entire skincare set and makes me feel like I want to do my dermaplaning session at the end of every week because it's so bougie. Luxury skincare for melanin-rich skin. That's what we're here for, baby. And I like that it's got this silicone cap which I can wash after a few passes. I will take this out, wash it, clean all the dead skin cells that are trapped within the dermaplaner as well. So if you've got a great tool like this, if you have steady hands, And if you don't have any of those contraindications that I talked about, and you feel confident enough, or you've tried doing some sort of dermaplaning on your own at home, then I would recommend getting the dermaplaner and giving it a go. The main thing is start low, go slow, and then see how your skin reacts. Because for melanin-rich skin, you don't want to overzealously do anything, because you want to see how your skin reacts to it. Because if it does have a negative reaction, you can hyperpigment, and we do not want that. So the process, so I'm going to insert a few clips here of the things you should and shouldn't do. The first thing you need to make sure is that your blade is clean every single time. So either replace your new blade or wash your one that you've just used once before or twice before. You want to prep your skin, first of all. So prep your skin by cleansing your skin and dabbing your face, ideally with cold water, because you want your blood vessels to shrink shut, not vasodilate and get all irritable and irritated when you're dermaplaning. Then you want to hold your dermaplaner parallel to your skin, never perpendicular, never in a cutting motion, always parallel to your skin and potentially on a slight angle depending on what curvature you're facing. You want to hold your skin taut when you're doing it, not let it relax, and then there's more chance that the blade is going to contact the skin in a perpendicular manner rather than a parallel manner. And you want to make sure that you're super, super slow over areas that are sensitive. So you avoid areas that are super sensitive in general, but areas I avoid is right under my eyes. I avoid areas where I'm going to cut myself around my nose, and it's also advisable to avoid around inside your nose, because that's where we hold majority of our bacteria cells or our bacteria microbiome. So majority of the streptococcus and staphylococcus species that live on our skin and our body come from our nose. And so by dermaplaning that area, then taking your scalpel and putting it up here, and if you cut yourself, you can potentially introduce a staph infection higher up or in other areas. So if you're doing your face, leave your lips and your upper lip last, and you want to avoid your nose and your nostril hairs. Next, when you're going parallel, you might need to flip depending on the direction of your hair growth. Everyone's hair grows differently and in different directions. What is generally recommended for shaving of any sort is always go with the grain of your hair growth. So if your hair's pointing this way, you want to go this way. If your hair's pointing that way and you cut it off this way, you're more likely to cause an ingrown hair and cause a reaction like folliculitis. So essentially you want to go with the grain of your hair, not against the grain of your hair. Then you want to do light feathery passes. So you want to do multiple little passes over the skin until you feel like the peach fuzz has been removed and the top layer of the dead skin cells have been removed. You do not want to be able to cause bleeding, because that's going way too deep. You do not want to be able to cause gravel rash or a burn. You just want to be able to scrape off that top layer of the skin, and you might need to go through multiple passes, hold the skin taut, and really have good control over your blade. The lower that you hold it down, the more control you have, but the less distance you will travel. The further away, it's going to be harder and you're going to be wobbling everywhere. So that's why I love this, because it's got the handle to know exactly where to place your hand for optimal control while still getting the best in terms of your strokes. Now, this is so important. After a few passes, you will notice with our dermaplaner, there will be little dead skin cells that are trapped within the divots and the grooves. And that's great because you've actually seen how effective it is. So with my dermaplaning sessions, I'm cleaning this at least 10 times. And after each pass, I can see the dead skin cells. I get it underwater, I wash it off, dry it, and then go again in my next section. You want to clean your blade with every pass, because the more that it's filled up with crap and the more bugs that you carry into each section of your skin, the more likely you are going to face issues and complications from dermaplaning, which we'll talk about next. Once your blade is blunt, you must replace it. Blunt dermaplaning is going to cause problems. It is going to irritate your skin, it's going to cause ingrown hairs, and it is going to cause irritant contact dermatitis, which is not what you need for melanin-rich skin. And also, you're not going to get the benefits. The efficacy is not there. You no longer are getting the benefits of removing that top layer of dead skin cells and replacing it with good skincare. You're just essentially brushing it over with a blunt blade. So get a dermaplaner where you can replace your blades regularly for that reason as well. Now, we've talked about cleansing before pat drying your face. Now, should you do a dry dermaplane So should you dry shave or dry exfoliate, or do you want to do a wet exfoliation? So it really depends on your skin. If you've got very ultra sensitive skin, it can actually help to use something like an Aquaphor or a light moisturizer to help with the dermaplaning process, particularly when you're getting started. I would say I would avoid using oils to dermaplane. A lot of the time I see videos of common oils used to dermaplane your face. Using an oil and brushing the oil over that skin, although you might be removing the dead layers of skin, you're then oversaturating that comedome, that follicle, the skin unit, with more oil and not allowing it to actually breathe and let your actives then penetrate. So if you do have very sensitive skin, a lightweight moisturizer, and make sure you cleanse it off really well afterwards. If your skin can tolerate it, doing a dry dermaplane and doing a very soft and superficial dermaplane to begin with is a really good idea as well. Just please don't cut yourself. That's the last thing you want to do. Cutting yourself means that you can keloid and you can form a hypertrophic scar, and you can also get a skin infection. So avoid cutting yourself at all costs. Start low, go slow. Dermaplaners, people. Now, your post-dermaplaning care. What you never want to do is just dermaplane and then walk away and walk out in the sun and do lots of things. Touch your face with multiple soaps and fragrances and cleaning equipment, or spray yourself with spritz. So you really need to look after your skin essentially after dermaplaning is what I'm getting at. You want to make sure that you are cleansing with a cold water cleanse, a gentle cleanser, ideally nothing that has a really strong chemical peel, chemical exfoliant, because that is going to sting and burn. What's the point? You've already exfoliated. You just need something gentle to get away all of the peach fuzz and all the remnant dead skin cells. Then I go in with the Dewy Glow serum and I use a smaller amount. So I won't like do a really large dose of this. I'll do a smaller dose and I'll rub it all in. You can just go in with a hyaluronic acid serum if you've got sensitive skin. And essentially what you're looking for is a serum that allows your active ingredients to penetrate, but doesn't burn and doesn't sting for more than a minute. Dewy Glow generally stings for a second for me, and that's it because I'm so used to using it now after dermaplaning, but you just don't want anything that's going to overly react with your skin. As already mentioned, you never want to use soap, you never want to use fragrances, and you never want to use a harsh exfoliant cleanser with mechanical beads or harsh chemical exfoliation after your dermaplaning session. I would avoid a retinol serum at this stage. I would avoid tretinoin as well. And then you want to go in with a lightweight moisturizer to lock in all of that moisture. Your skin will be deficient in moisture after dermaplaning. Never think that you're going to cause more acne and clog your pores up more if you add a moisturizer. You must seal in that hydration, particularly with most serums containing hyaluronic acid. You must seal in that hyaluronic acid moisture, otherwise it's actually going to be more drying for your skin. So please go in with a lightweight moisturizer that's one, non-comedogenic, doesn't cause acne, and two, is oil-free and fragrance-free. One with ceramides, glycerin, squalane, they're all really good options. Squalane and ceramides would probably be my top two options. You also want to protect it from the sun. You have taken off the top layer of your dead skin cells, so you want to make sure that you do wear SPF. A chemical sunscreen that gets absorbed, a mineral just sits on the top of the skin and is a really good option to protect yourself from UV, then burning your skin further or causing more damage. And that's my little tips and tricks on how I do the dermaplaning process. So what are the risks of dermaplaning? We've touched on these throughout the video, but the main risks are number one, scarring. So you can cut yourself too deep if you're doing inappropriate methods and techniques, or if you're using a really blunt blade and going over it multiple times and then you end up cutting yourself. If you slip, you can cause a cut, and that cut or laceration can unfortunately lead to keloid scarring and hypertrophic scarring on your face. And unfortunately, us melanin-rich brown skin ladies are at risk of that. Our skin does produce a more enhanced response to scarring with more collagen deposition and bundles of collagen that can then form those types of really disfiguring looking scars. So you do want to be very careful not to cut yourself. Number two risk is pigmentation. Any trauma to the skin, any treatment that you do, CO2 lasers, microdermabrasion, dermaplaning can still cause pigmentation. You need to know what your skin is like. I pigment at the drop of a hat. I'll get the tiniest little acne scar. You can probably see mine there. And the smallest little pimple, you can't even notice it sometimes. It will leave a brown spot for months. So anytime I accidentally cut myself with a dermaplaner, I know that there's a chance that area is going to hyperpigment. Post-inflammatory hyperpigmentation is our most common problem. If you get a post-inflammatory hyperpigmentation scar with dermaplaning, you need to use really good active ingredients and get on top of it sooner rather than later. And you need to protect yourself from the sun. You need to be wearing hats, you need to be wearing sunscreen, sunnies all the time so that that pigmentation doesn't become permanent and deep. You want to get on top of it with tyrosinase inhibitors, all the good things that we talk about in our pigmentation video and how to protect your skin from the sun. So go check that one out. The other risk of dermaplaning is that you can bleed. Obviously, if you go down to your jawline, so I often dermaplane right down to here, and if you cut yourself or go this way, you can literally bleed out. So please be careful around your neck. I know it is commonly seen in movies where someone's got a scalpel and they're at their barber's and they get a throat slashing because someone slips and then they exsanguinate. Literally. Because this is a scalpel, it is not just a multiple little shavers that are protected like a male shaver. You need to be careful around areas like your neck. You do not want to cut yourself or slip or accidentally cut your neck, and you don't want to injure your eye. So be really, really cautious in certain areas. My top areas of concern are like the 3 areas here. So the eyes, because you can poke your eye out, because the epidermis around your eye lid margins is very thin, so you can cut yourself here, and generally you don't need to dermaplane right under your eyes because there's not much benefit. And you want to be mindful of your perioral region or your mouth, so particularly because of the location of where all our bugs sit, and also because you don't want to cut your lips. And lastly, the neck, because you don't want to get your external carotids or your jugular veins slashed. So that's a real big risk, but an important one to mention. Unlikely if you're using something with a good grip like this one. That's why we didn't go for a glossy finish either. We went for a matte finish because it just needs to be that much more sturdier. Even though it's not glossy like our serum bottle, it's a scalpel, can cut. Of course, the other risk is overdoing it. When I started dermaplaning, I kind of became addicted to it because you see that your skin just soaks up your actives and it really helps. But I was doing it way too often. So I would go over areas multiple times and I would just go too deep. And I basically gave myself like a friction burn or a gravel rash. So it's really important to not go over one region multiple times. You just want to do a few light feathery passes, and when you feel like your skin is starting to get raw, you need to stop, and stop even before that. You can always reassess in 24 hours and redo an area, but you can't take back taking off a layer of your skin unintentionally. So just always stage it and check how you're going. So I would not recommend dermaplaning more than twice a week. I think if you've got very, very thick hyperkeratosis and lots of skin turnover and flakiness, you can consider it, but I would probably only do it once a week, particularly for melanin-rich skin. And that's what you're here for, to hear all about how to look after your beautiful brown skin. So once a week is my go-to, or fortnightly if you don't feel like you need it. But if you're not starting to notice bumps and lumps form and the dermaplaning helps with that, then I would go in weekly. So we know that in your 20s to 30s, it takes about 28 days to 40 days for your skin's cells to turn over. By the age of 50, it takes 84 days for those same skin cells to regenerate, turn over, and get rid of the old dead cells. So it's quite a lengthy process as you age, and that regeneration of skin, that turnover of skin, really contributes to things like collagen production, stimulation of cytokines to produce newer and more youthful skin. Dermaplaning is the fastest, cheapest, and easiest way to be able to speed up this process. And if you've listened to this video, you've watched this video, you've taken in all of the shortcuts, tips and tricks, how to do it safely and effectively for melanin-rich skin, I think that it's something worthwhile to try, and it has merit and it has evidence, albeit not large-scale studies, because we're always lacking large-scale studies for home DIY treatments, things like turmeric, things like dermaplaning, things like even microdermabrasion. The large-scale studies are minimal. There is no studies on dermaplaning on skin of color, full transparency, but it's looking at patient populations, because obviously skin of color, as you know, is under-researched, understudied, and underappreciated. But as we know, it behaves very similar to skin that's sensitive, that's eczema prone, because of our low-grade inflammation states, because of the melanin problem 5 issues that we face and have. Go check out that video if you haven't already. So by extrapolating that, the science that we have for dermaplaning in those skin conditions, we can then apply it safely to skin of color, and hopefully one day start doing studies on our skin and test out this bad boy on a skin of color study population, which, you know, I hope we have funding to do one day. At this stage, if you're following the tips and tricks that I've talked about, you're not going to go wrong. And if you know which patient groups or which personal group you fit in where you shouldn't do it, don't do it. There's no point. Don't take the risk. Just stick to basic skincare. I hope you enjoyed watching this video, and please go hit the bell to see when my next video is coming out. We aim to drop every week, and make sure you also go subscribe to our channel and go check out our Instagram and TikTok at Rockmelon. It's all about my brand, me and hubby's brand, and to get some more educational knowledge on your beautiful melanin-rich skin. Signing out. Bye.